Hi, my name is Denisha Blair. I am a nurse practitioner student for South College, and today I will be performing a head-to-toe assessment. The first thing I did was introduce myself to my patient here, who is a 21-year-old male. I did his vital signs. His blood pressure was 128/74. His heart rate was 84. His respiration was 16. His temperature was 97.6. His height is 6'1". His weight is 195 pounds. His oxygen level was 96. And because of his height and weight, he is in normal range for his BMI. Right now, I'm going to ask him a few questions. So I would like to know, what is your name?
Tom Ford.
And when is your birthday?
6803.
Do you know what today is?
August 3rd, 2024.
And do you know who our current president is?
Joe Biden.
So with him answering those questions, he is alert and oriented times. His head is symmetrical in midline, no discoloration noted. Now I'll be placing on my glove because I have to check his head and his hair. Are you doing okay, Mr. Ford?
I am.
Good. So we're checking his head. I noticed there's no lesions. There's no discoloration in the head. The hair is evenly distributed. All right, let me check this. No issues noted with the hair and the head. No involuntary movement. Now, Mr. Ford, I'll be checking for what we call your cranial nerve 7. And so I'm going to ask you to do a few things, okay? The first thing I need you to do is clench your teeth, okay? Clench your eyes, okay? Smile for me and frown for me. Now, can you puff out your cheeks? Thank you. His cranial nerve 7 is intact. The next thing I will be checking for is tenderness and pain in your maxillary or your frontal sinuses, okay? So as I touch you, you let me know. Are you feeling any pain or tenderness there?
No, ma'am.
Okay. All right. How about now? You feel any pain or tenderness as I press on him?
No, ma'am.
All right. Thank you so much there. Okay. Now, Mr. Ford, I'm going to palpate your lymph nodes, okay? First. Alright, I'm going to palpate your clavicle. What I've discovered, there is no enlargement and they are equal and bilaterally. Now, Mr. Ford, I will be testing what we call a cranial nerve number 5. So I need you to clench down for me. And I'm going to palpate right here. There is no distortion. There is great strength there. Next, I will test the sensory part of the trigeminal nerve, okay?
Yes,
So wherever I told you to, wherever I touch, I need you to tell me where it is, okay? Close your eyes. Yeah. Oh, you got it closed. All right, here we go.
Forehead. Left cheek. Nose. Chin. Right ear.
Good job. Next, Mr. Ford, I'm going to check your ears and your ear canal, okay? So I'm going to have to pull your ear up and back, all right?
Yes, ma'am.
All right, let's see this one. Up and back. There's no swelling, no drainage noted. Your tympanic membrane is pearly gray. There is no cerumen noted. Your eardrums are good. Everything is well in your ears. The next thing I'm going to check is your pinnae, okay?
Yes,
so I'm going to touch the top of your ears and make sure that there's no pain or tenderness. Do you feel any pain or tenderness there?
No, ma'am.
So no pain or tenderness to his ears. The next thing I'm going to check is your cranial nerve number 8, okay?
Yes, ma'am.
By doing this, I'm going to have you cover one of your ears, one at a time, and I'm going to whisper some words into your ear and see if you can repeat those words, okay?
Yes, ma'am.
So let's cover your left ear first.
Yes, ma'am. 1, 2, 3.
All right, let's do the other.
Yes, ma'am. 4, 5, 6.
Cranial nerve number 8 is intact. I also did the Rhine and the Weber test. With the Rhine test, I made sure that the tuning fork was vibrating. I placed the stem of the tuning fork on the mastoid bone, and I also placed it in front of his ear. And I asked Mr. Ford, did he hear it longer than he felt it? And your answer was? So that means that the AC is greater than the BC, so everything is normal with that. I also did the Weber test. With the Weber test, I made sure that the tuning fork was vibrating. I placed it in the middle of his head, and I asked Mr. Ford, did he hear it on both sides? Was it louder on both sides or the same? And what was your answer, Mr. Ford?
The same.
The same. So that means that the Ryan and the Weber test both is normal. Now I will check Mr. Ford's eyes, and his scleratus is white and clear. No redness noticed. His conjunctiva, no drainage. Pink and clear, no redness noted. Next, I will check his cranial nerve 3, 4, and 6. And with this, it involves my light. So I will have Mr. Ford look at my light, look straight ahead. Pupils are at 3. They are round and equal and reactive to light and accommodation. Next, I will have Mr. Ford to move his eyes in certain directions. So Mr. Ford, can you move your eye, keep your head straight, but move your eyes to the left and up, to the right and up. Horizontal left, horizontal right, lower left, and lower right. Okay. And now, can you look straight ahead? And I'm gonna move my finger. Don't move your head. Good deal. And upon doing vital signs, we did the Snelling test, and Mr. Ford's vision was 20/20, so everything is okay with the vision. Now I'm going to check his peripheral vision. I'm going to have him stand straight ahead. And so, Mr. Ford, when I'm going to do a movement, and you let me know when you can see my hands, okay?
Yes, ma'am.
Can you see them here?
No, ma'am.
Can you see them here?
Yes, ma'am.
Can you see them here?
No, ma'am.
Can you see them here?
Yes, ma'am.
Can you see them here?
No, ma'am.
Can you see them here?
Yes, ma'am.
All right, thank you. You can be seated. Good and intact, nothing's going on with his eyes. Now, Mr. Ford, I will be inspecting your nose, and as I'm looking at it, it is midline. There's no fraction or lesions noted. Now I'm gonna take my light and kind of look in, okay? So I'm gonna press your nose up, and it is pink and moist. The septum, no deviation. Now I'm gonna do the same on the other side. Pink and moist. The turbinates are pink and moist with no deviation. And everything is good with Mr. Ford's nose. Now, Mr. Ford, we will be inspecting your mouth. And upon looking at you, your lips are pink. There's no issue noticed there. Now I'm gonna have you open your mouth, and I'm gonna take my light, I'm gonna look inside. Okay. As I look inside, there is no decay to your teeth. Your gums are pink and moist. Your soft palate and your hard palate are intact. Your mucosa is pink and moist. There's no issue there. Your tongue is smooth, and it's also pink and moist. Your posterior pharynx, let's see, is pink and moist with no nasal drainage. Now let me see your tonsils. All right, your tonsils is graded 1, which is normal. Now, earlier we tested the cranial nerve number 9, which is a gag reflex, and everything is well with that. And now we're going to test cranial nerve number 10, which is looking at the uvula. All right, and can you say "ah" for me? All right, so the uvula is symmetrical. No problems noted there. All right. Now we're going to test cranial nerve number 12. And with that, I need you to stick your tongue out and just go side to side with it. Good deal. No issues there. All right. Now I'm going to test your, check your TMJ, okay? So I'm going to feel in this area. Can I get you to open and close your mouth for me? All right, good deal. No pain or tenderness noted?
No, ma'am.
Okay, no crepitus noted, so the TMJ is intact, no problems noted there. And that is concludes the portion for the mouth. All right, Mr. Ford, now I will be inspecting your neck. And as I'm looking at it, it is symmetrical. Now I will palpate your trachea. Good deal. There is no deviation with the trachea. And now I will palpate your thyroid gland. And with that, I have to get your cricoid process. And I place one finger there and one finger on your substernal notch. And I have located both areas. And with now, I will ask you to swallow at one point, okay? Let me put my hand here. I'm going to retract here. And Mr. Ford, can you swallow for me? Good deal. All right, now I'm going to put my hand here. And I'm going to retract on this side. Mr. Ford, can you swallow for me? Good deal. There is no nodules noted in the thyroid gland. Now, Mr. Ford, I will be checking for what we call bruits in your carotid artery. I grab my stethoscope. And with this, I will tell you to hold your breath at one point and let go. So if you would, just a second. Hold your breath for me. All right, release. And again, hold your breath. Release. Good deal. No bruits noted with the carotid artery. Now we're going to do our flexion, extension, and things of that nature with your neck, okay, to make sure everything is going good with that. So the first thing I need to do is put your chin to your chest. All right, good flexion. Now I need you to look up to the ceiling. All right, good extension. All right, can you turn your head from left to right? Good deal. Now I need you to do what we call the lateral flexion. Can you put your head like you're going towards your ear, like this? Good deal. Let's go to the other side. Great, great. They are all intact and equal. Now we'll be testing cranial nerve number 11, okay? And with that, I'll be putting pressure on your shoulder. And I need you to try to do some resistance. All right, good deal. Nice and equal and intact. So that covers our neck portion of the assessment. Now, Mr. Ford, I will be listening to your heart and your lungs. And the first thing I need to do is grab my stethoscope. All right, so now what I'm gonna do is place this here, which is on your aortic valve, which is on the second intercostal space, right sternal border. Now your pulmonic valve, which is on the second intercostal space, left sternal border. All right, move down just a little to your Erb's point. Third intercostal space, left sternal border. All right, a little bit more to your tricuspid. Fourth intercostal space, left sternal border. And to your mitral, which is in the mid-clavicular line, fifth intercostal space. Mr. Ford, I didn't hear any murmurs. Your normal heart rate, which is the love dove sound, the S1 and S2. And upon looking at your anterior wall, there is no deformities noted. Now I'm going to listen to your anterior lungs, okay?
Yes, ma'am.
And with this, I'm going to need you to take a deep breath in and out for me, all right?
Okay.
Out for me. Deal. In. Out for me. Good deal. In. Out for me. Great. In. Out for me. In. Out for me. One last time. In. Out for me. Anterior lungs are clear. No wheezing or anything like that noted, okay? Next, I need you to stand up for me. And if you would turn around, face the wall. Earlier, I did check his PMI. and that was on the 5th intercostal space. I palpated it. It's at 2 centimeters. There's no problems or issues noted. His apical pulse was actually 80 when I checked that. So now, Mr. Ford, what I'm going to do is I'm going to, check your vertebrae. Do you feel any tenderness?
No, ma'am.
Any issues noted there while I rub and when I touch it?
No, ma'am.
All right, so it's straight, no deformity noted, no deviations noted. Now I'm going to listen, and when I listen to you, I want you to say E, okay?
Yes, ma'am.
This is when we test the agorphony, okay? So here we are. I'm gonna have you say E as I listen to you, okay?
Yes, ma'am.
All right.
E, 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 E.
Good deal. Thank you so much. Stay just like that. So when we testing the agorphony, what we're listening for is make sure that the breath sounds are distant as we move down, and his was, so that means that's normal. The next test I'll be doing is what we call the tactile fremitus. Okay, so I'm going to be touching on your back, Mr. Ford, and as I touch your back in certain areas, I need you to say 99 for me. Okay.
Yes, ma'am.
All right.
99, 99, 99, 99.
Good deal. So both sides are equal. There is no problems with his tactile fremitus, and lung sounds are clear. No issues noted, Mr. Ford. You can have a seat. I appreciate that so much. So his heart and his lung sounds have been done. All right, Mr. Ford. Now I will be doing his upper extremities. And the first thing I will do, can I touch your skin? Yes, his skin is warm and dry to touch. And now I will be checking for his capillary refill. Can you just hold your hands out that way for me? Good deal. Less than 3 seconds on that hand. Also less than 3 seconds on that hand. Now I'll be checking for your pulses. If you can just kind of hold your hand like this, like mine. There we go. All right. Radial pulses are normal, not bounding. And brachial. Same with the brachial pulses, are normal, not bounding. Next thing I'm going to do is check for his strength in his hands. So can you squeeze my hand, Mr. Ford? Good deal. That is a 5 out of 5. And now I'm going to check for his strength with his biceps. All right, Mr. Ford, can you hold your hand like this? And I'm going to push, and you kind of push against me. All right, that is a 5 out of 5 with that. And also, no, keep your hands just like you had them. And now push against me. All right, triceps is a 5 out of 5. Now I'm going to do a range of motion with his shoulder. All right, so flexion, extension. Good deal. Other shoulder, flexion, extension. Great. Now I'm going to do a range of motion with the shoulder. So with the shoulder, this is flexion, extension, internal rotation, external rotation, abduction, and adduction. All right, just kind of relax that. Let's do it with the other arm, with the other shoulder rather. Flexion, extension, internal rotation, external rotation, abduction, and adduction. All right, relax for me there. Good job. Everything is good with that. All right, so now can I get you to put your palms on your thighs and kind of do this motion for me and go faster. So that's good. We are checking with that. I'm checking his cerebral coordination. So that was good. Now, can you take your fingers and with your thumb, now press your, there we go, each one, and keep doing it, repeating it. Good deal. Coordination is intact. There's no issue there. Next thing I'm gonna be checking for is, and we use what we call the Tennael sign and the fallen sign in order to check for carpal So can I see your wrist right here? So right here I'm gonna tap, and that I'm tapping is the medium nerve. Mr. Ford, are you feeling any type of numbness or tenderness with that?
No,
All right, and with the fallen sign, I'm gonna have Mr. Ford place his hands like this. All right, Mr. Ford, are you feeling any type of tenderness or numbness while you're doing that?
no, ma'am.
All right, so that is what we do in order to check for carpal. So the upper extremities have been done for Mr. Ford, and to our next assessment. Now, Mr. Ford, I will be testing your deep tendon reflexes as well as your patella reflexes. And with that, I'm going to place my thumb right here where your medial aspect of the antecubital fossa. And I'm going to hit my thumb, okay?
Yes, ma'am.
All right, good contraction there. Do the same for this one. Good contraction there. All right, the next thing I'm gonna do is, like I said, I'm gonna check your patella.
Yes, ma'am.
And let's see. All right, good. Good deal, good reflexes with that. All right, so we was good on that, Mr. Ford. All right, Mr. Ford, now I will be examining your abdomen. So I need you to kind of lift your shirt up for me. All right, upon looking at your abdomen, it is symmetrical. No, and I'm looking for contours. No distortions found. And now I'm going to list to all 4 quads, okay?
Yes, ma'am.
Bowel sounds present in all 4 quads. Now I will be listening for any bruise, which is in the aortic area right below the xiphoid process, okay? No bruise noted. All right, Mr. Ford. Now I will do the left renal, which is above the lateral to the left umbilicus. Now I will do the right renal, which is the right above the umbilicus. Now I will do the iliac to the left and below the umbilicus. Now I will do the iliac to the right, which is below the umbilicus. No bruise heard in those areas either. Mr. Ford, now I'm gonna percuss all 4 quadrants, okay?
Yes, ma'am.
All right, so that was determined if you have any tympany or dullness or any flatness. Did you feel any pain or anything like that?
No, ma'am.
Okay, now I'm gonna palpate it, okay?
Yes, ma'am.
When I was palpating, Mr. Tom, did you feel any pain or anything like that? Because I didn't feel any masses while palpating all 4 quads.
No, ma'am.
Now, Mr. Ford, I will palpate your liver and your spleen, beginning with your liver, okay?
Yes, ma'am.
So I'm going to place the palm of my hand underneath your back here. And I'm going to look for your mid-clavicular line. I'm going to place my hand right here. So I'm going to press up. Take a deep breath for me. All right, and I feel the edge of your liver. All right, now I need you to turn towards me. Lateral, there we go. I'm gonna do the same thing. I'm gonna place my hand on your back, and this is to check your spleen, okay?
Yes, ma'am.
So I'm gonna need you to take a deep breath. All right. I'm pressing upward and downward, and I do not feel the edge of your spleen, which is normal. So that is wonderful there. Now I need you to lay back on your back for me. Now I'm going to test your the Bloomberg sign, okay?
Yes,
so this consists of me pressing down in your abdomen, okay? So did you feel any tenderness or anything like that?
No.
All right, good deal. Now I'm going to check for your what we call the McBurney point. And this is where you find your ASI, which is right in this area. And then you find your umbilicus, that area. And about 2/3 down is where you find your McBurney point, which is also your appendix. All right, Mr. Ford, now we're finished with the abdomen part. You can put your shirt down. And now I need to examine what we call the coastal vertebral angle. So if you will stand up for me, and if you will face that wall for me and kind of raise your shirt up. With this, we are looking at the 12th rib, because that's where your kidney lies, right here and in between your spine. So I'm gonna test it and make sure you don't feel any type of pain or tenderness, okay?
Yes, ma'am.
Anything there?
No.
Anything there?
No, ma'am.
All right, good deal. So no tenderness noted with the CBA. All right, if you have a seat for me, Mr. Ford. All right, Mr. Ford, now we are looking at your lower extremities. And as I'm examining your legs, I see there is normal hair growth, no discoloration. You don't have any swelling noted, no redness on your joints or anything in that nature. Now I'm going to check your popliteal pulses, and that is me placing my hand underneath your knees. All right. They are 2+ equally bilaterally. Of course, earlier, like I said, you're and it's warm to touch. No issues noted there. Now I'm going to check your posterior tibia pulses. All right, they are 2+. That is good. And lastly, I will check your dorsalis pedis pulses. They are 2+, and that is good. And of course, adequate hand washing was performed, and good technique was done. Now we'll be doing the range of motion of your hip, okay? So there's certain things I'm gonna ask you to do. The first is, and we perform both legs, of course. The first is, Mr. Tom, I need to do a flexion. All right. Now let's do an extension. Okay, now we're gonna do abduction. Good deal. Now we're gonna do adduction, cross the midline. Good deal. Now we're gonna do internal. There we go, good job. All right, now we're going to do external rotation. All right, if you'll hold it, go on straight down for me. Good deal. That was all good. Now we're going to do the flexions of your knees, okay? So we'll push your knees up. There we go. If you'll push against me. All right, now push against me. All right, strength is 5 out of 5. All right, Mr. Ford, we have came to the last part of your assessment, which is checking your spine. So I would need you to stand up for me. All right. So on palpating your spine, I realized that there's no deviation noted, no curvature noted. The spine is intact. Now I need you to bend over for me. Touch your toes. All right, now straighten up. All right, now bend backward for me. All right, straighten up. Now I need you to do a lateral flex. So you just there we go. All right, other side. Good deal. Now I need you to do rotation. You kind of just twist your, good job. All right. So that is active range of motion. So we're good there. Now I need you to take a few steps forward. Come a few more. Turn around. Step back towards me. All right, your gait is good. Okay, now I need you to stand with your arms to your side. Close your eyes for like 20 seconds.
Yes, ma'am.
Thank you. This is called the Romberg's test. This is determined to make sure that you wasn't kind of leaning and stuff while you had your eyes closed. So that means you have good balance. Last but not least, completed my assessment today, and I want to thank my volunteer patient, Mr. Ford, here for allowing me to do a head-to-toe assessment on him. Thank you very much.